Good afternoon, everybody, and thank you for joining. This is Rob Travia. I'm with the Diversity Consortium, and you're listening to XBE Thrive. Today, we've got a super exciting topic. As the Diversity Consortium is looking to make a measurable difference in the supplier diversity landscape, we have looked both at the corporations and what we can do to help companies to encourage growth of diverse supply base. We've also looked at how do we develop diverse businesses. And as we're looking at this, we've tried to understand what the challenges are and how do we meet those challenges. So we have brought together about 25 companies who each individually have been doing supplier diversity for decades. And these are businesses that provide everything from strategy to training and mentoring and coaching and onboarding and outreach, right? So we're looking at all of the things that collectively are going to drive successful relationships between diverse businesses and the corporations, and how do we nurture that, how do we grow that, and how do we help those businesses expand. You're going to hear about the term XBE quite a bit today. XBE is nothing more than a disadvantaged or a diverse business. It's a small business. It's most likely you, right? If you're listening, there's a good chance that you're a small business, that you're a woman-owned business, that you're African-American owned, that you're Latin owned, that you're LGBTQ owned, you're disabled, you're a veteran. All of these things collectively, we're just going to call XBE to be all inclusive. So the Diversity Consortium, our purpose is to bring together services to be able to help and nurture that growth. And just a little bit of housekeeping before we begin. You'll notice we're using Microsoft Teams. This is a live event. You've got some volume controls. You'll also have a way to choose some chats. You'll notice where that little pop-up bar on the right-hand side, you can ask questions. We're going to ask that you provide answers today when we're talking about some survey questions and things like that. We'd like you to go ahead and use that box to go ahead and put in your responses there. So, as I was mentioning, the Diversity Consortium has offerings both to the corporation. On the left-hand side, you're going to see some of those offers, such as the strategy and outreach and onboarding, and all of these things are aimed at helping a company bring their need out to the marketplace and find those diverse businesses, be able to sort and navigate their way to find out who's really best at doing what they're looking for, and to be able to bring them on board and then report it in a way that's meaningful to them and to their community. What we also look to do is to be able to provide services down market, so to speak, to the businesses, to the businesses themselves. How do we help them? And if they are better prepared for business, I spent 30 years managing and running procurement and pushing out RFPs and RFQs. And to me, it was all about QCDR, quality, cost, delivery, and responsiveness. And if you were a diverse business, that was a bonus, but you certainly had to have your quality, your cost, your delivery, all those things in place. So those are some of the services that we're looking for. But as we also were looking at what it was that would help these businesses succeed and thrive, we recognized that there was a challenge. And one of those challenges was that, healthcare is the costs are rising exponentially. And it's very difficult for small businesses. It's very difficult for disadvantaged and diverse businesses to be able to offer healthcare plans that were reasonably priced. So what we did was we went out into the marketplace and we went and found a solution. So that's what we're going to talk about today. We're going to talk about the options that you have to be able to provide meaningful and affordable healthcare to your employees. So with that, I'd like to introduce our partner, First Call Health Services, which is an organization that has got some amazing offerings. And to tell us a little bit about it is Olivia Petz. Olivia is the general manager of First Call Health Services and She's got a background in law. And Olivia.
Thank you, Rob. I am so happy to be here with you guys today and to share some exciting and, you gave us a great introduction, but what we feel are some necessary developments in a space that has traditionally been underserved. So without further ado, let's kind of jump into what we've been working on over here at First Call Health.
Excellent.
I think the way to do this is to just kind of start off with a question to our audience, and that is going to be, do you provide healthcare benefits for your employees? And if so, is it funded in part or in whole by the company? If you're able to input your answer so we can get a little bit of feedback, that would be great.
So while we're giving you some time to answer this, if you notice you've got that chat bar on your screen, you can go ahead and where it says ask a question, just go ahead and type in your response there. You could write yes or no if you have it or not. We'd also love to know, as Olivia had mentioned, a little bit of detail around that. Is that something that you're co-sponsoring with your employees, or is that something that's fully funded? Those kinds of things. We'll give you just a few more seconds to respond. And by the way, you can continue to answer, but in a few more seconds, Chris, could you tell us what you're seeing?
Yeah, Rob, we're getting a few inputs here. It looks to be about 50-50 and some elaborating on what providers they do have.
Oh, that's awesome.
Okay, that's great. So what we are typically finding is that it is very common in the XBE space for a plethora of different reasons that we'll touch on throughout the presentation. But for XBEs to not be able to or not offer these employee health benefits to their employees, which is the issue that we are looking to address here with First Call Health Services.
So tell me a little bit about First Call.
So First Call Health Services was created to address this very issue. It was created to help put XBEs on a level playing field, if you will, with these big corporations that can afford extensive benefit packages for their employees. With that, it's one thing to be able to afford them at the going rates, but we really sought out to be able to offer you something better than that, which is, what if I were to tell you, Rob, that we could offer you an option for your employees at $100 to $150 a month for healthcare benefits? Is that something that sounds like you would be interested in?
Sign me up, because I got to tell you, I'm paying about 10 times that right now. So I would love to hear more. So let's talk about what we're going to talk about today, and then you get me into some of those details, and I'm dying to hear more.
Yeah, of course. Can you start us off with kind of just a high-level overview of what the DC is seeing in the XBE landscape?
Absolutely. So from the Diversity Consortium's perspective, we're working with, we've got 100,000 small businesses, veteran businesses, LGBTQ businesses within our reach, and those organizations are coming back and telling us that, number one, they're challenged, and they're challenged because they're not able to provide health care to their team. And what that's doing is twofold problem. First problem is it's causing a lack of something that they can offer their employees that want to keep them, to attract them, and to retain them. The second problem is that as they're not being able to offer this, they're also finding that their employees are calling in sick, that their employees are, not excited to come in. They're just finding that their health care is in decline. So this is a big issue for us, and it's a big challenge for the XBEs that we work with. Obviously we've reached out to First Call, and we'd love to learn more about direct primary care. So I hope you're going to tell us a little bit about that as well.
Yeah, absolutely. So direct primary care, it's been around for ages, right? This isn't a new business model, but it is an alternative, if you will, to traditional healthcare insurance programs. To be clear, it's not an insurance program, but it's a model that provides access to high functioning healthcare with a simple, flat, affordable membership fee, and it allows physicians to offer their services directly to patients or employers as a healthcare option instead of having to go through these extensive networks and costly systems. So really, it's bringing that high quality care directly to the patient. And then we also have on the screen here leverage service network, excuse me. And what that is, it's a component of this idea that, you know, you're going to have people that work in a place that they don't live and vice versa. So how does an employer offer health services, you know, when their employees are geographically spread out throughout different areas?
Oh, that's awesome. Well, thank you so much. You know, as we're working with these XBEs, these disadvantaged businesses, we're often finding ourselves in front of the corporations trying to make that match. And those corporations, you know, I'll share with you a conversation I had with the chief procurement officer of a Fortune 50 company. And he said, Rob, why do we need you? You know, we're members of the NMSDC. We're members of WeBank. We have access to the NGLCC database. So we know everybody that's out there. And I said, Miguel, I'm sorry, but you know, you're only seeing the very tip of that iceberg.
Mm-hmm.
You know, if you look at how many businesses are actually certified today on NMSDC's website, it says 12,000. And yet there's 23 million small businesses in the United States alone, small and disadvantaged and diverse businesses. So, you know, what we're looking at is there's plenty of good organizations and they're doing great things, don't get me wrong. But those organizations are not necessarily where they're not representing the full breadth of the XBEs that are out there. And those are the businesses that we're trying to support. So, you know, as we looked at that, Olivia, tell us about the problems that you found.
So you kind of hit the nail on the head with that, right? If we look at this chart, the top problems for small business owners, a lot of these on this list, so the cost of providing healthcare, attracting new customers or clients, retaining the cost of business, attracting and retaining top quality employees, and, you know, competing with these bigger corporations that are able to offer extensive benefit plans all kind of tie into each other, right? With the exception of the 5th and the 7th one on the list here, they all kind of feed off of each other. And what we're finding is that these XBEs are having a problem retaining and keeping their talent. And healthcare coverage is right up there. You know, I know it's something that's important to you. It's something that's important to me, because at the end of the day, you really want to be able to provide for your family. So again, the XBEs are unable to do so at the cost that it's being provided in the marketplace right now, which puts them at a huge disadvantage and sets them back with attracting and maintaining top talent. So we partnered with, you know, the DC in order to come up with a solution for this.
Well, that's great. And, you know, at first I was looking at this and you know, I'm sort of an averages kind of guy, and I look at this and I say, well, there's not that much of a spread between the top 5 or 6 answers. But as you've just described, you know, if I were to realize that the number one problem, cost of providing healthcare, really drives attracting and retaining quality employees, you put those two together, and now I see why this is so important. So thank you.
Absolutely.
So what is the XBE health plan, direct primary care? Tell me a little bit about what First Call is able to offer here.
Yeah, of course. So again, just to touch on this, direct primary care has been around for a long time. So why do we choose it? Again, we're bringing the focus back on the XBEs here. We want to be able to provide healthcare that's affordable, accessible to employers and employees, and something that helps, you know, that helps solve the medical challenges of today while helping the XBEs remain competitive in the marketplace. We wanted to do something different, and that's why we're going out and doing it. A couple identifying elements of this is that, you know, we are working directly with the physician, and the business model includes, you know, no copays, no deductibles, 24-hour access to your physician, same-day appointments. And it's really answering and calling upon, you know, what's missing in not only the healthcare system, but also with the benefit packages and being able to provide that to your employees.
Did I hear you say same-day appointments?
Same-day appointments, you know, up to unlimited access to your doctor, as many appointments as you want. And again, this is what we'll touch on later, but I think something to really note here is the cost. It's going to be available at $100 for an individual or $150 for a family, which is just really unheard of in today's day and age.
So I guess in order to understand, just what you've just said, please tell me a little bit more about what you see today and what the differences are, if you could.
Sure, yeah. Well, in the current landscape of the healthcare market today, it's no secret we're seeing rising costs that are ever changing, complex and expensive traditional insurance programs, and it takes 2 months, 3 months sometimes to get in to see your doctor, which is, in my opinion, is unacceptable. But unfortunately, that's just what we see in today's marketplace. So we are really trying to provide, higher quality service at a cost that is affordable to employers, to be able to give their employees a benefit that is going to be of value to their employment and bring value to their life.
Wow, that's fantastic. From a diversity consortium perspective, we've got quite a base of XBE businesses, and I know that this would make a huge difference to be able to offer healthcare, access to healthcare, to be able to get appointments and to be able to, do all of that at the dollars you were quoting. That's pretty amazing.
Yeah, and another great feature, and I'm not sure if this is going to be touched on down the line, but of this is that it's not just to the direct, employee. There's the option to bring on their family. So not only are you providing your employee with this amazing benefit, it extends to their family, and that goes up to for $150 per family. You are having direct access to a physician that is solely concentrated on this pool of patients within the XBE network, with unlimited access. And down the line, we will have numerous locations and also a mobile clinic, which we can touch on a little bit more later. I'm sure there'll be questions on that. But we're really trying to provide, an all-encompassing healthcare plan at a low cost and quality service.
Well, that's great. And, we're absolutely thrilled to have you on board, and we're excited to be able to offer this kind of service out to our businesses. And I, as you had mentioned as well, will certainly help the businesses attract and, retain folks, because all too often, over my 30-year career, I've heard, people coming to the corporations because they'll do that for less pay, because just to get the benefits. They know that there's value in that, and there's a big risk if you don't.
Absolutely, and it's a huge challenge, and so it's a space that we saw that needed addressing, and we really think that this business model and this partnership is going to be able to go in and help businesses and employees raise their standard of care and living.
Excellent. So, big picture, tell me what do you see, and tell me how this works.
So big picture, we are hoping to be able to take this nationally, right? A national direct care provider rollout, but let's look at it a little bit lower of a view. We are starting with our initial location in Columbia, South Carolina. We will be seeing patients starting in October, as early as October 2021. From there, we will be expanding to 3 additional geographic locations within South Carolina. And we will also have a mobile clinic that's able to reach the rural areas, so that we really have that full breadth of outreach throughout the state. It's our plan that we will eventually end up in 50 states, and this will be something that will be available nationwide, because again, it's a service that's needed, and it's providing something that of great value. So we think that it'll continue to build. Another element of this is we will be partnering with different affiliated partners such as dental, catastrophic, vision, so that you can really come to us and get your one-stop shop, if you will, for all the healthcare that you need, such as emergency services or, again, dental, vision. So it'll really encompass all of it.
Wow, that's great. That's a really good thing. So I know we've sort of gone through this very quickly, and I guess I'd like to pause here and perhaps take some questions from the audience.
Of course.
So if you haven't already, and if you would please enter in your chat box some questions that you've got for myself or Olivia, we'd be happy to do our best to answer them for you.
Absolutely.
So,
Rob, we've had a few questions come in so far. The first one is, what about emergency care? Would that be handled?
So I can take that, Rob. And that's something that I just briefly touched on. So again, yes, emergency care, it is not something that is directly from our direct primary care, but we will be partnering with, different insurance programs to offer these things such as emergency care at a discounted rate. So you will have the opportunity to build this all-encompassing plan if that's what you're hoping to do.
Thanks.
Absolutely.
Second question is, what if I lived outside of town? How would I access healthcare?
So again, we are hoping within the states to have multiple locations throughout each state eventually. And for those, rural areas, we will have these mobile clinics where we will be able to X amount of times a month come out to your location and you'll be able to receive service wherever it is that you live. That's something that was really important to us when building out this model, is that we want to be able to offer these services to everyone that's within our network, because that's something, again, that we feel is missing in today's traditional healthcare market. There's a lot of people that live in far-reaching geographical locations that really don't have access to good healthcare. So that was something that was important to us as we were building this out.
I agree, and I'm gonna just reiterate a little bit here that small businesses or for that matter, any business, right? You don't necessarily get all of your employees in the area where the business is operating. So, I know my commute to, was anywhere from 20 minutes to an hour and a half each way every day. So, with that said, I think the fact that you're offering a mobile solution in multiple cities is awesome. Because it's not necessarily that I always, work where I live and play. So I would certainly want access to healthcare, in both, right? Because you don't know when you're going to need it, and you don't know if you're going to be going right from work, right before work, or right from home. So I think that's a great offering. Thank you.
Absolutely. Great
Chris.
question.
A few more questions. Yeah, a few more questions. Next one is, can I share the cost of the program with my employees?
Yes, absolutely. Rob, do you want to take this one?
Sure. So that's a great question, and very often we find that employers want their employees to have a little skin in the game. What they've found is if they just provide things for free, that often those employees aren't taking advantage of the services because they don't look at them as valuable. But when they do contribute a little bit to them, it makes that much more investment beneficial to the relationship. And the answer is absolutely yes. So we are offering this to all XBEs and their employees. And the way that this works is that an employer can sign up for all or as many of their employees as they would like. And we can then provide those services to those employees, and you get to decide as the employer if you want to charge your employees for a portion of that. But when the rates are $100 per person per month, or $150 per family, now that's a pretty reasonable dollar amount that I think would be a great number. Whether it's shared or it's fully on me, I'd be absolutely thrilled to be able to see numbers like that.
We've got time for about two more questions. The next one is, how do you manage when I add or remove employees?
Yeah, so that's a great question. Olivia, would you like me to answer that, or would you like to?
I can take a whack at it and you can elaborate, but it's prior to the month of service, employers will have the ability to add or remove coverage for any of their employees. So that's what's great about this program, is that the employer is going to have control over their employees that they're coming on and going off the plan, and will work directly with us in order to facilitate that on a monthly basis. Rob, do you want to elaborate on that at all? Did I miss anything?
No, I think you did a great job. And, what's really neat about this is that unlike this open enrollment and all of the things that I had been part of before, where you were forced to make decisions months in advance, and then whatever decision you made, you were stuck with for a year. Um, what I love about what you've just described is that you're not locked in. So at any given month, you can change what you're doing. You can add employees. You can remove services if need be, if someone else has gone somewhere else. That this gives me a lot more flexibility. It is something that's reasonable and I can afford, and it really addresses my needs. Right? You've touched on my daily needs. I love what I heard before, that I can have 30 to 60 minutes with a physician. I have to tell you, uh, yes, I spend more than that when I go to a normal visit, but it's not with the physician. It's I spend it by myself in a waiting room. I spend it by myself in the exam room waiting. I spend it, a minute here or a minute there with a nurse, and then I get my time with a physician. And it's usually pretty brief, and they're on the run. And I get it. But I love the fact that that's not this model. I love the fact that I could actually be proactive and ask my physician questions and try to get ahead of my health and take control of my health. So this is really exciting.
Absolutely, and I think you really hit the nail on the head again with that, is that it's going to provide individuals with an opportunity to be proactive about their healthcare needs, right? You don't have to wait 2 months, and you don't have to wait until you're feeling ill to get access to your doctor. You can go in and discuss, how to live a healthier lifestyle and plan out so that you can prevent this illness in the future, as opposed to being reactive, because you do have that direct access and there's no time limit on it.
Well, that's great. Chris, I think we've probably got time for a couple more if you've got.
Yep. Next question is, can the general public sign up?
So that's a really good question. And I'm gonna take the first part of this answer, and then I'm gonna pass it to Olivia, because I recognize that Olivia's answer will be different than mine. So from the Diversity Consortium's perspective, if you all just think about the way that our model works, what we've done is we've mapped out all of the areas of need. We've found subject matter experts that fill each of those needs. And again, our purpose is to make a difference in the supplier diversity landscape. So we are laser focused on XBEs and corporations who want to help and grow diverse businesses. So from the Diversity Consortium's perspective, we are focused on bringing on small businesses, diverse businesses, disadvantaged businesses, which again, that XBE, all-encompassing businesses. So if you are not a disadvantaged business, you really wouldn't be coming to the Diversity Consortium to sign up. Now, that's not to say that we wouldn't pass you to our partner, who Olivia now is going to give you her response from her perspective. So with that, Olivia, would you tell us what you would do with someone who was not an XBE?
Yes, of course. Well, right now, as you said, we really are, and we built out this model to concentrate on the XBEs. So for our initial launch, that is really who we're going to be targeting and what we'll be doing. I think that there's certainly room down the line to expand it to individuals, but right now we are concentrating on those XBEs. Eventually down the line, there will be room for that. It's a business model that I'm sure many people want to be involved in. So it is something that will be available to people that are not being brought on board through the XBEs, but right now through our main pipeline, it is starting off. It's kind of where we are retaining and targeting, if you will. But it will be a service that's available to others.
Excellent. So Chris, I'm not sure if we answered that question thoroughly, but again, just in recap, the Diversity Consortium is really focused on providing the service for XBEs, but it sounds like First Call Health would welcome anybody, although they're initial focus is on XBEs and the relationship that we're working together. Is that correct?
Yes.
Perfect. Perfect. All right, Chris, what else you got?
Yeah, last question. Do all my employees have to take this healthcare plan?
No, that's the beauty of this. You know, it's not something that is being forced upon your employees. It's something that that's a great benefit that you are able to offer your employees. So if it's something that your employee wants to opt out of, they're absolutely able to do that. Again, this is just a service that is being provided in order to really help your business, you know, become competitive and attractive and provide quality service. So it's really in the hands of the employer how they would like to offer that to their employees.
Wow. Well, thank you so much, Olivia. And on behalf of the Diversity Consortium, I'd like to thank you all for listening. I hope you found this helpful. I hope you found it informative. I hope you're intrigued, because I certainly am. And when I learned about this model, I was super excited, as I still am today, about the opportunities in front of us and really being able to make a difference for small businesses and disadvantaged businesses alike. Because this, I think, will make that difference. Just wanted to remind everybody that this is part of the XBE Thrive series. The XBE Thrive, we have very high-level information dives around, you know, specific areas of topic. The next one is what is an XBE and what does that mean? So as I've described, the XBEs being disadvantaged business, diverse business, what does that mean, right? So what, right? I'm an XBE, but there's a lot of benefit, there's a lot of challenge, there's a lot of advantage to being an XBE, and so we're going to have a dive around that and discuss how to take advantage and some of the opportunities that are out there and some of the things that are available at your fingertips if you just knew about them. So that's what we're going to share in a couple of weeks. In September, we're going to talk about the power of certification and so on. So this is something that we do every month. I'd also like to remind our audience that we have micro topics. So as we're having these discussions today about healthcare, we're going to continue to do that once a month. Just as well, we're going to have conversations around each of those topics that you see up on the screen. So these will be very focused areas. And again, if you hear something that you'd like to learn more, if you're welcome, of course, to come directly to our website. It's there at the bottom, and I'm going to leave this up there for a few moments so you can all see. It's thediversityconsortium.com. You can find information about anything that you've heard about today. You also have my personal mobile number. That is the number up there on the screen, as well as my direct email. And I would be happy to get questions that you have directly to any of our presenters, to Olivia, or on any of our other series if you've joined our other Thrive events. Please just let me know. I'd be happy to help. So with that, I thank you all. I appreciate what you do, and I am here to help. If you got some question and you don't know where to go, just shoot me a line. I'd be happy to help you if I can and point you in the right direction. So thank you again. Thank you, Olivia. It was truly a pleasure.
Absolutely. Thank you.
All right, folks, have a great afternoon, evening, and morning, depending on where you are. And until next time, thank you.